Yeah, it is. It is an exciting time for our field. I would say it's the beginning. Well, no, the end of the beginning, I would say. And I'll qualify that. It's a really foundational time for two reasons. Because now we have a class of drugs, first generation drugs, and over the next 10 years or 15 years, we'll learn more and improve, just like multiple sclerosis did 20 years ago, 25 years ago. But we have a toehold with drugs like donanemab that are considered disease modifying. So we have two of them approved now. Lecanemab was the first one, donanemab more recently. And it is important because for the first time we can show that these drugs affect a core pathobiological process in Alzheimer's disease that are defining, which is removal of amyloid plaques. And along with that, what's important as a general characteristic of a disease-modifying drug is that it does something to the slope of decline, of clinical decline. So what we're seeing is between standard of care or placebo group, which may decrease like this over time if you pick the patients correctly. With these drugs, it sort of, on average, that's the average effect, would be mitigating the slope, so slowing the slope down. And these, and donanemab was studied over 18 months in the Trailblazer 2 study, but had very, very consistent effects. So, very, very exciting time because it shows that we have a foothold. And we can, over the years, learn how to give these to patients to improve the efficacy, to find out who may be more responsive, and then also mitigate the burden and the side effects, which need safety monitoring, things like small areas of swelling or bleeding that can occur. But again, we do monitoring MRIs and can manage those things overall. Rarely, very rarely, there can be untoward effects. So it's really, really important to choose the patient correctly. But overall, the benefits are really, really consistent. And they're not just like, oh, well, it does something to this one little aspect of memory. The important thing is that what you see is whether it's the primary outcome or the secondary outcomes, they're all going in the same direction. And what they show is that for a group, you're slowing things down about on average 20 to 30%. Now, if patients have less tangles in the brain, which means the disease in the brain is a little bit less progressed, that average effect size, that benefit may be larger. And so, part of this is picking the right patient, having those discussions with patients and families about risk and benefit, whether this may be a treatment for them or not, and then translating it in language that is understandable to them and not giving them false expectations. These are not drugs that we would say, oh gosh, we're going to give you these drugs and they're curative and they're going to take you back to the way that you were years ago. But we are finding very, very hopeful results that we can build on.